Good evening. Tonight we're talking about vapes. Specifically, the flood of brightly colored, illegally imported, and unregulated e-cigarettes now in every corner store and gas station in America. Instead of soldiers, we're being overrun by disposable plastic tubes that taste like gummy bear and watermelon bubblegum, most of them from China. These products arrive in shipping containers, move through shadowy networks, and end up in the hands of anyone with a few bucks, including, disturbingly, a lot of teenagers. It's a public health mess and a regulatory fiasco. For every one product the FDA has authorized, there are hundreds of illegal ones sitting right next to it on the shelf. They haven't been tested for safety, their nicotine labels are often wrong, and the companies making them care more about profit than public health. The FDA is playing regulatory whack-a-mole while the moles are driving bulldozers. Tonight, we're going to untangle this mess and ask, why is the FDA failing so spectacularly?
To understand this regulatory train wreck, let's talk to people who've seen it from the inside.
The FDA was given authority to regulate these products, but having authority and using it effectively are two very different things. We've seen press releases, not real enforcement.
Dr. Anya Sharma, public health policy expert, says the problem exploded when the FDA failed to create a clear, predictable path for new, safer products to get authorized. The system was so slow and opaque, it created a vacuum, filled by thousands of illegal products from China.
The administration talks tough on youth vaping, but lets the market be overrun by products that appeal most to kids.
Instead of a clear rule, we got a confusing patchwork of enforcement that targeted some companies and ignored others. This told Chinese manufacturers, the market is open, the rules are negotiable, and the chances of getting caught are slim.
The FDA's failure to act decisively created a massive incentive for illegal importation. When it's nearly impossible for legitimate companies to get products approved, but easy for illegal ones to be sold, you're shaping the market for bad actors.
The number of unique illegal vape products has skyrocketed. It's not a coincidence. It's a consequence of a flawed regulatory strategy that's left kids dangerously exposed.
The FDA's job is to review every new tobacco or nicotine product through a pre-market tobacco product application, or PMTA.
The problem? The FDA has been buried by millions of applications and has approved just 23, all tobacco-flavored. Thousands of applications are stuck in bureaucratic limbo, leaving the field wide open for rule breakers. The glacial pace means almost nothing new can get legal approval, so illegal manufacturers fill the gap. Companies spend millions on studies, only to be told their applications are deficient for arbitrary reasons. Why would anyone invest in safer alternatives if the FDA's process is a dead end? The only innovation is coming from illegal Chinese manufacturers who don't bother with applications. They can launch a new flavor in weeks, while legitimate companies spend years in the FDA maze. The FDA's failure has effectively outsourced the American vape market to Shenzhen.
The most serious consequence of this regulatory failure? Kids. The black market is a teenager's paradise. Vapes in neon colors, shaped like cartoon characters with flavors like Blue Raz Ice. These products are engineered to appeal to young people who'd never smoke a cigarette. The packaging is discreet, the vapor doesn't smell, and the flavors mask the harshness of nicotine. Some disposables contain as much nicotine as several packs of cigarettes, hooking kids faster than ever. While youth smoking rates are at historic lows, youth vaping remains a persistent problem, driven by disposable, flavored products from overseas. The FDA's strategy of denying flavored products has backfired, pushing demand to an illicit market that's even more appealing and dangerous. These vapes are sold on social media, in stores that don't check ID, and online with flimsy age checks. The most attractive products for youth are now the most widely available, precisely because they're outside any legal framework. We wanted to protect kids from nicotine, but by failing to regulate, we've fed them to the wolves. Wolves that taste like fruit salad. The result, millions of kids using illegal vapes while the FDA dithers.
When politicians say smarter regulation, what does that actually mean? It means a system that can tell the difference between a product that helps a 50-year-old quit and one designed for a 15-year-old. The FDA's current approach treats all non-tobacco products as equally dangerous, which isn't true. Smarter regulation would create a clear, science-based pathway for product approval, with standards companies can actually meet, If a company proves its product is less harmful and has measures to prevent youth access, it should have a real chance at authorization. Enforcement should focus on the worst actors, importers and distributors of illegal vapes from China. That means more inspections at ports, heavier fines for retailers, and cracking down on online sales. Prohibition doesn't work. The FDA's de facto ban on flavored vapes just created a massive black market. A smarter approach would allow a limited range of regulated, adult-oriented flavors, while strictly enforcing rules against marketing to kids. The just say no strategy has failed. It's time for a system that protects both adults trying to quit and kids who shouldn't be targeted. Smarter regulation isn't a slogan, it's a necessity. Let's not forget the 28 million adult smokers in the US. For many, quitting through patches or gum hasn't worked. Harm reduction, switching to a less dangerous alternative, could save lives. Vaping isn't harmless, but it's much less harmful than smoking. Other countries encourage smokers to switch. Burning tobacco creates thousands of chemicals. Vaping doesn't involve combustion. Providing a viable, regulated alternative could save millions.
The FDA's refusal to approve new flavored vaping products takes a powerful tool for quitting off the table. They're so focused on the risk of a teen starting to vape, they ignore the certain risk of an adult continuing to smoke. Adult smokers need reliable, properly labeled products and flavors that help them quit cigarettes. The current market offers a terrible choice. Stick with deadly cigarettes, try one of the 23 bland FDA-approved vapes, or gamble on a mystery product from China. A real public health strategy would ensure appealing, well-regulated options for adults who want to make a less harmful choice.
Enforcement at our borders is almost non-existent when it comes to disposable vapes. These products are small, easy to mislabel, and often slip through customs as battery chargers or plastic tubes. The sheer volume of imports makes it impossible to check everything, and CBP focuses on bigger threats. Importers exploit loopholes, breaking large orders into smaller ones to avoid detection. Our agencies are outmatched and outmaneuvered. The FDA sends warning letters to retailers, but does little to stop the problem at the ports. We need a coordinated effort, better intelligence, more inspections, and technology to scan cargo for illegal vapes. Right now, enforcement is reactive, not proactive. By the time products hit shelves, it's too late. The failure to control the border makes every other regulatory failure worse. Until we stop illegal products at the source, the black market will thrive and the FDA's authority will remain a joke.
To understand how we got here, compare the last two administrations. The Trump administration tried to clear the market of unauthorized flavored vapes, but exempted disposables and menthol, creating a massive loophole. Manufacturers immediately pivoted to disposable flavored vapes.
The Biden administration let the FDA's slow PMTA process play out, resulting in a near total denial of new products. Their public stance is strict enforcement, but in practice, it's been a trickle of warning letters while the illegal market exploded. The administration talks about protecting kids, but has presided over the largest influx of illegal, youth-appealing vapes in history. The Trump plan was aggressive but flawed. The Biden approach is slow and paralyzed.
One administration shot a cannon and missed, the other is using a slingshot against a fortress. Neither has worked, but the current strategy has let the problem metastasize.
This isn't about politics, it's about competent governance. What's needed is a smarter, more coherent approach, robust border enforcement, a functional product review process, and real harm reduction for adults. The current path isn't working. It's time to stop the posturing and build a regulatory system that actually protects public health. Total word count, approximately 1,828 words.